What would you do if a doctor looked at you and said, "You don't have much time left"? Isabella Navarro was 28 years old when her life ended on a rain-soaked Boston highway. Her brain was dying. The bleeding wouldn't stop. Every doctor said the same thing: impossible to save. Except one. Dr. Marcus Reid saw something in her case, a chance so small it barely existed, an experimental treatment never tried before, a gamble that could save her life or end it instantly. This is the story of 7 days that defied death itself. And you won't believe how it ends. The rain hammered against the windshield like bullets, each drop a tiny explosion of water that blurred the world into streaks of light and shadow. Boston's streets glistened under the streetlights, slick and treacherous, as the evening traffic crawled through the downpour. Inside the sleek black Mercedes, Isabella Navarro sat in the passenger seat, her dark hair cascading over her shoulders, her hazel eyes reflecting the city lights that danced across the wet glass. "We should have stayed," James said, his hands gripping the steering wheel tighter than necessary. His voice carried that edge of worry she'd learned to recognize over their 2 years together. Isabella turned to him, a soft smile playing on her lips despite the storm. "The deal closes tomorrow morning at 8. If I'm not there, 3 months of work disappears." Her Spanish accent colored the words with warmth, even as she discussed business. At 28, she'd already climbed higher than most executives twice her age, and she wasn't about to let weather derail everything she'd built. James glanced at her, his blue eyes softening. "You know, that's not what worries me. The roads are perfectly fine." Isabella interrupted gently, reaching over to touch his arm. "You're an excellent driver. We'll be at the hotel in 20 minutes, and tomorrow you'll watch me close the biggest deal of my career." The traffic light ahead turned green. James pressed the accelerator, and the Mercedes moved forward, joining the flow of vehicles navigating the rain-soaked streets. Neither of them saw the truck. It came from the left, running a red light at 60 miles per hour, its brakes screaming uselessly on the wet asphalt. The driver had been looking at his phone for just 3 seconds. 3 seconds that would change everything. The impact sounded like the world ending. Metal screamed against metal. Glass exploded into 1,000 glittering fragments, and the Mercedes spun like a toy, momentum carrying it across 2 lanes before it slammed into a concrete barrier with a sickening crunch. The airbags deployed with explosive force, but they couldn't stop the laws of physics. Isabella's head snapped sideways, striking the window frame with a sharp crack that cut through the chaos. Then silence. Terrible, ringing silence broken only by the hiss of the rain and the tick of cooling metal. James opened his eyes, tasting blood, his vision swimming. "Isabella?" His voice came out as a whisper. "Bella?" She didn't respond. Her head lolled against the seat, blood trickling from her temple, her hazel eyes closed. The dashboard lights cast her face in an eerie glow, making her look like a broken doll. "No, no, no, no." James fumbled with his seatbelt, his hands shaking so badly he could barely work the release. "Help! Someone help us!" The rain continued to fall. Somewhere in the distance, sirens began to wail. 8 miles away, Dr. Marcus Reid stood in the doctor's lounge, staring at his reflection in the dark window. At 37, he looked older. The kind of weathered that came from too many sleepless nights and too many impossible decisions. His dark brown eyes, set beneath heavy brows, carried a permanent intensity that made residents nervous and nurses wary. His dark brown hair, peppered with premature gray at the temples, was disheveled from 14 straight hours in the operating room. "You should go home, Marcus." Dr. Patricia Chen appeared beside him, her scrubs still splattered with blood from their last surgery. "You've been here since 6 this morning." "So have you," Marcus replied without turning from the window. "Yes, but I'm not the one whose ex-wife's lawyer called today." Patricia's voice softened. "I heard about the custody hearing." Marcus's jaw tightened, a muscle jumping beneath his stubble. Lost again. Apparently being a trauma surgeon means I'm an absent father. The bitterness in his voice could have stripped paint. 3 years of fighting, and my daughter barely knows my name. Patricia touched his shoulder. "Marcus." The overhead speaker crackled to life, cutting her off. "Code red, trauma 1, ETA 3 minutes. Major MVA, critical head injury, female, 28 years old. Dr. Reid to trauma 1 immediately." Marcus was already moving before the announcement finished, muscle memory taking over. He grabbed his stethoscope, shrugged into a fresh white coat, and headed for the stairs. Faster than waiting for the elevator. His personal pain compartmentalized, locked away in that mental box where he kept everything that didn't involve saving lives. The trauma bay erupted into controlled chaos as the ambulance backed into the bay. Rain poured through the open doors, and the paramedics wheeled in a gurney at a near run. The woman on it was young, beautiful even in crisis. Her dark hair matted with blood, her designer clothes torn and soaked. 28-year-old female, high-speed MVA, significant head trauma. The lead paramedic rattled off as they transferred her to the hospital gurney. GCS of 6, pupils unequal and sluggish, BP dropping. We've had to intubate on scene. She coded once during transport, got her back after 2 minutes. Marcus's hands were already moving, checking her pupils with his penlight, palpating her skull, his dark eyes scanning every visible injury with the focus of a predator. "Get me a head CT stat. I need O-neg blood, 4 units. Someone page neurosurgery. No, never mind. I'll handle it myself." His voice cut through the noise like a scalpel, sharp and precise. A man burst through the trauma bay doors, his face white, his shirt torn and bloody. "That's her. That's Isabella. Is she... God, is she alive?" "Sir, you need to step back," a nurse said firmly, trying to guide him away. "I'm her boyfriend. I was in the car. Please, you have to save her." James's voice cracked, raw with terror. Marcus looked up for just a second, meeting the man's eyes. What he saw there, the desperate animal fear of losing someone precious, was a mirror of everything Marcus had felt the day his own life fell apart. "We're doing everything we can," he said, and meant it. "But I need you to let us work." The gurney was already moving, Isabella's still form surrounded by a swarm of medical personnel, each one performing their role in the desperate dance of emergency medicine. Marcus walked alongside, his hand on her wrist, feeling the weak, thready pulse beneath his fingers. "She's going to die," whispered a voice in the back of his mind. The voice of experience, of statistics, of cold medical reality. The injuries he'd seen in that first assessment were catastrophic. But Marcus Reid hadn't become one of Boston's top trauma surgeons by listening to that voice. As they rushed toward the CT scanner, the rain continued to hammer against the hospital windows, each drop marking another second in Isabella Navarro's race against death. And in that moment, neither the doctor nor the dying woman knew that their lives were about to become irrevocably intertwined, bound together by a storm, a crash, and a choice that would test the very limits of medical science. The clock on the wall read 11:47 p.m. Isabella had approximately 4 hours before her brain would swell beyond saving. 4 hours before the damage became irreversible. 4 hours before Marcus Reid would have to decide between following protocol and risking everything on a procedure so dangerous it had never been successfully performed at Boston University Medical Center. But first, he needed to see exactly what they were dealing with. As the CT scanner hummed to life, Marcus Reid allowed himself one deep breath. Then he became what he'd always been, a weapon against death, sharpened by years of training and loss, aimed at the impossible. The storm outside grew stronger. It grew. The CT images appeared on the screen like a death sentence written in shades of gray and white. Marcus Reid stood in the darkened radiology reading room, his arms crossed, his jaw working as he studied each slice of Isabella Navarro's brain. Behind him, Dr. Chen and 2 neurosurgery residents waited in silence, knowing better than to interrupt when he was processing. "Jesus," one of the residents finally whispered. Marcus's eyes never left the screen. Massive epidural hematoma, right temporal region, subdural bleeding on the left, midline shift of... He leaned closer, his finger tracing the screen without touching it. 8 millimeters and growing. Uncal herniation beginning. His voice was clinical, detached, but his knuckles had gone white where his arms pressed against his chest. "That's surgically inaccessible," Dr. Chen said quietly. "Marcus, the bleeding is too deep, too diffuse. If we go in there, she dies," Marcus finished. "And if we don't go in there, she dies anyway. Probably in the next 3 hours." He turned from the screen, and the residents instinctively took a step back. His dark eyes had that look, the one that said he was already 10 steps ahead, calculating odds, weighing options, preparing for war. "What's her history? Anyone get information from the boyfriend?" "I did," said a nurse who'd just entered, tablet in hand. "Isabella Navarro, 28, Spanish national working in Boston. No previous medical history, no medications, no allergies. She's a corporate executive, VP of International Operations at Meridian Tech. The boyfriend says they were heading to a hotel near the convention center. She has a major business deal closing this morning at 8. The nurse paused. Had, I guess. Marcus took the tablet, scrolling through the admission notes. A corporate VP at 28? Smart, driven, ambitious, probably worked 80-hour weeks, probably thought she was invincible, probably never imagined dying on a wet road in a city far from home. Just like his daughter would never imagine losing her father to the job that consumed him. He shook the thought away. Where's the boyfriend now? Waiting room. Minor injuries, refused treatment. He won't leave. Prep OR3, Marcus said, handing back the tablet. I'm taking her to surgery in 20 minutes. Dr. Chen stepped forward. Marcus, I know that look. Whatever you're thinking. I'm thinking she's 28 years old, Patricia. I'm thinking she's got maybe 3 hours before the pressure in her skull crushes her brainstem. I'm thinking that textbook protocol says we drill burr holes, try to relieve some pressure, make her comfortable, and watch her die. His voice rose slightly, that iron control slipping just enough to show the rage beneath. I'm thinking I didn't spend 15 years learning how to cut into people's brains just to stand aside and watch them die from something I might be able to fix. What procedure are you considering? Dr. Chen's eyes narrowed. Marcus pulled up a new image on the screen, a complex anatomical diagram. Decompressive craniectomy with acute hematoma evacuation. But I'm going in through a modified Tyrrional approach, working around the temporal lobe instead of through it. if I can reach the bleeding vessels, ligate them, and remove the blood before the brain swells." "That's impossible," one of the residents blurted out. "Dr. Reid, no one successfully performed that approach for this type of injury. The mortality rate is 100% if we do nothing," Marcus snapped. "So we're going to try something. Chen, you're with me. Someone get anesthesia up here now. And someone tell that boyfriend that his girlfriend is going into surgery, and it's going to be a long night." James Carter sat in the waiting room, his head in his hands, dried blood still crusting his hairline. The emergency room doctor had tried to examine him, but he'd pushed them away. How could he think about his own bruised ribs when Isabella was somewhere in this massive hospital, broken and bleeding? His phone buzzed. 12 missed calls from Isabella's boss, 7 from her mother in Madrid. He couldn't answer any of them. What would he say? That he'd been driving? That he hadn't seen the truck? That the last thing she'd said to him was, "You're an excellent driver." "Mr. Carter?" James looked up to find a tall, intimidating man in surgical scrubs standing over him. The man's dark brown eyes were hard, assessing, but there was something else there too. A flicker of understanding that didn't match his stern expression. "I'm Dr. Marcus Reid. I'm the trauma surgeon treating Isabella." James shot to his feet. Can I see her?" "No." Marcus's voice was firm but not unkind. "Mr. Carter, I need you to listen very carefully. Isabella's injuries are severe. She has significant bleeding in her brain, and the pressure inside her skull is rising. If we don't operate immediately, she will die within the next few hours." The words hit James like physical blows. "Operate. Okay, do it. Whatever it takes." "It's not that simple." Marcus pulled up a chair and sat, gesturing for James to do the same. It was a calculated move. Sitting made him less intimidating, more human. He'd learned that trick years ago from a mentor who told him that delivering bad news standing up made you look like an executioner. "The procedure I'm proposing is extremely risky. The bleeding is in a part of her brain that's very difficult to access. I'll have to remove a portion of her skull to relieve the pressure and try to stop the bleeding. But there's a significant chance she won't survive the surgery. And even if she does survive, there's no guarantee she'll wake up, or that she'll be the same person you know." James stared at him, his face crumbling. "What are you saying? That I have to choose between letting her die for sure or maybe dying on the operating table?" "No," Marcus said, his voice softer now. "I'm saying that she's dying either way. But surgery gives her a chance. Maybe a small one, but a chance nonetheless. I need your permission to proceed. I need you to understand what we're facing." "What's her percentage?" James asked, his voice barely above a whisper. "If you do this surgery, what are her odds?" Marcus met his eyes directly. He'd never been good at sugarcoating, and he wouldn't start now. "Honestly, less than 20% chance of survival. Maybe 5% chance of meaningful recovery." He paused. "But 0% if we don't try." The silence stretched between them, broken only by the distant beep of monitors and the hushed conversations of other families facing their own nightmares. James thought about Isabella's laugh, the way she bit her lower lip when she was concentrating on a contract, the way she'd looked at him just hours ago and told him everything would be fine. "She'd fight," James said finally. "Isabella would fight. She's the most stubborn person I've ever met. If there's even a 1% chance, she'd take it." He looked up at Marcus. "Do the surgery. Please, save her." Marcus stood, and for just a moment, His stern mask cracked. "I'm going to do everything I can, Mr. Carter. I promise you that." He extended his hand, and James shook it, feeling the strength and steadiness in the surgeon's grip. "Why are you doing this?" James asked suddenly. "If it's so dangerous, if it's never been done before, why risk it?" Marcus paused at the doorway, his hand on the frame. He thought about his daughter's face, about his ex-wife's words. "You care more about strangers than your own family." He thought about all the patients he'd lost over the years, all the times he'd followed protocol and watched people die anyway. He thought about the moment he'd become a doctor, not for glory or money, but because he'd believed he could make a difference. Because someone has to. He said simply. Then he turned and walked away, his footsteps echoing down the corridor as he headed toward OR 3, where Isabella Navarro lay waiting, balanced on the knife edge between life and death. Behind him, James slumped back in his chair, alone with his thoughts and his guilt and his desperate prayers to a God he wasn't sure he believed in anymore. The clock on the wall read 12:23 a.m. In the operating room, nurses were prepping instruments, anesthesiologists were calculating drug dosages, and Dr. Patricia Chen was scrubbing in, mentally preparing for what might be the most difficult surgery of her career. And Marcus Reid stood at the scrub sink, watching the water run over his hands, washing away the blood of the last patient, the last surgery, the last day of his old life. Because something told him, some instinct born of years at the edge of death, that this case would change everything, that Isabella Navarro was more than just another patient, that somehow saving her might also save him. He dried his hands, pushed through the OR doors, and stepped into his arena. The bright lights, the sterile smell, the hushed anticipation. This was where Marcus Reid made sense. This was where the chaos of his personal life fell away, and he became something pure, a weapon of healing, focused and deadly. "Let's bring her in," he said. And the storm outside, forgotten by everyone inside the hospital, continued to rage. The operating room was a cathedral of controlled chaos. Isabella Navarro lay on the table, her head locked in a 3-pin skull clamp, her dark hair shaved away on the right side, exposing pale skin that would soon be opened to reveal the storm inside her skull. The anesthesiologist, Dr. Raymond Park, monitored her vitals with the intensity of a man defusing a bomb. "BP's holding at 90/60, Park called out. "Heart rate 110. ICP monitor shows 32 millimeters of mercury and climbing." Marcus stood at the head of the table, his gloved hands hovering over Isabella's exposed scalp. In the harsh surgical lights, every detail was stark, unforgiving. The bruising around her temple, the subtle asymmetry of her pupils beneath closed lids, the too rapid pulse visible in her carotid artery. Her body was screaming that it was dying, and it was his job to prove it wrong. "Intracranial pressure at 32, Dr. Chen repeated from across the table. "Marcus, we need to move fast. Above 40 and we lose her for sure." "Scalpel," Marcus said. The instrument appeared in his palm, its weight familiar, almost comforting. He'd held thousands of scalpels in his career, made tens of thousands of incisions. But each one still carried that razor edge of consequence, the knowledge that he was about to cut into a living human being, that every movement mattered, that there was no undo button. The blade touched skin, and blood welled up in a precise line as Marcus made his incision. A large question mark curve that would allow him to peel back Isabella's scalp and expose the skull beneath. The cautery tool hissed and smoked as he controlled the bleeding, the smell of burning flesh mixing with the sterile scent of the OR. "How's she doing, Ray?" Marcus asked, his eyes never leaving his work. "Stable for now," Park replied. "But I'm not liking these blood gases. She's not oxygenating as well as I'd like." "She's got bleeding pressing on her brain stem," Marcus said, using retractors to hold back the scalp flap, exposing the white bone of Isabella's skull. "Once we relieve that pressure, her breathing will improve." "Chen, high-speed drill." The drill whined to life, a sound that always made residents flinch. Marcus marked out a large section of skull, the bone flap that would give him access to the damage beneath. The drill bit through bone with a spray of fine powder, following the line he'd traced, creating a window into Isabella Navarro's dying brain. 28 years old, Marcus muttered, more to himself than anyone else. Probably never had surgery in her life before tonight. Probably terrified of hospitals. The bone flap came free in his hands, revealing the dura mater, the tough membrane protecting the brain. Except the dura was bulging outward, tense and purple with the pressure of blood that didn't belong there. "Jesus," one of the residents breathed. "That's the worst herniation I've ever seen." Marcus's jaw tightened. The resident wasn't wrong. The brain was swelling so badly it was pushing outward, trying to escape the rigid confines of the skull. He could see the pulsation of blood vessels, the angry red of inflammation, the dark pools of blood collecting beneath the membrane. "What would you do here, Dr. Morrison?" Marcus asked the resident, his tone sharp. "You've got 30 seconds before she herniates completely. Talk to me." The resident stammered. I'd open the dura, try to evacuate the hematoma." "And she'd die on the table," Marcus interrupted. "The bleeding's too deep. You open that dura without a plan, and the pressure drop causes every damaged vessel to rupture. Blood everywhere, brain tissue tearing, patient dead in 2 minutes. "Chen, what's your move?" Dr. Chen's eyes were focused on the operative field. "Controlled opening. Small durotomy first. Let some pressure off gradually. Get better visualization before we commit to full evacuation." "Exactly." Marcus held out his hand. 11 blade. The next 15 minutes were ballet performed with knives. Marcus made a tiny opening in the dura, and dark blood immediately began to seep out. Not the bright red of arterial bleeding, but the thick, clotted maroon of venous blood that had been sitting there, pressing on Isabella's brain, killing her by millimeters. He suctioned carefully, removing blood while trying not to damage the delicate brain tissue beneath. "ICP's dropping," Park called out. "Down to 28, 25. She's responding. BP's coming up too, 100/65. Marcus allowed himself the tiniest nod of satisfaction, but his face remained stone. They weren't out of the woods. They hadn't even really entered the woods yet. The blood he was removing now was just the surface layer. The real problem was deeper, where vessels had torn and were still bleeding, where every second of delay meant more damage, more swelling, more brain cells dying. He opened the dura fully now, folding it back to expose Isabella's right temporal lobe. The brain itself was swollen, angry-looking, its normal gray color obscured by bruising and inflammation. And there, deep in the sylvian fissure, he could see the dark shadow of the main hematoma. "That's the target," he said, pointing with his suction tip. "Right there. Middle meningeal artery, probably torn at the branch point. I need to get in there, find the bleeder, and clip it. But to get there, I have to work around. He gestured at the swollen brain tissue. All of this, without causing more damage. That's impossible, the resident whispered. No, Marcus corrected, his voice cold. That's surgery. Chen, give me the microsurgical instruments. We're going spelunking. Dr. Chen hesitated for just a fraction of a second. Marcus, if you retract that brain tissue too much, you could cause permanent damage. Speech, memory, motor function. And if I don't retract it, she's dead. Marcus shot back. I know the risks, Patricia. But right now, Isabella Navarro has two choices. Die for certain, or risk being changed. I'm betting she'd choose being changed over being dead. He paused, his eyes meeting Chen's over their surgical masks. Wouldn't you? Chen nodded slowly. I'd choose life. So would I. Marcus positioned the surgical microscope, bringing the operative field into crystal clarity. Under magnification, Isabella's brain looked like alien landscape. Peaks and valleys, rivers of blood vessels, the mysterious terrain of human consciousness laid bare. Somewhere in this 3-pound universe of neurons and synapses were Isabella's memories, her personality, her dreams, her love for James, her ambitions, everything that made her who she was. And Marcus was about to go digging through it with metal instruments. Retractor, he said. The instrument slid into place, and Marcus began the delicate process of moving brain tissue aside, gently, carefully, creating a corridor toward the bleeding deep inside. Every millimeter of retraction risked damage. Too much pressure, held too long, and he could cause a stroke. But too little, and he'd never reach the source of the bleeding. Sweat beaded on his forehead. A nurse dabbed it away without him having to ask. ICP's rising again, Park warned. 32, 35. She's fighting us, Marcus muttered. Her brain is swelling faster than we can decompress it. We need to move faster. Marcus, if you rush this... Chen started. I know. The snap in his voice silenced the room. Marcus took a breath, forced himself to slow down, to focus. Rushing killed patience. But so did hesitation. The key was finding that perfect middle ground, moving with purpose but not panic, with speed but not recklessness. He advanced deeper into Isabella's brain, following the trail of blood like a hunter tracking prey. And then he saw it. The torn vessel, pulsing with each heartbeat, pumping blood into spaces where it didn't belong. It was smaller than he'd expected, maybe 3 millimeters across, but it might as well have been a fire hose for all the damage it was causing. There you are, Marcus whispered. Chen, clip, the small one. The aneurysm clip appeared in his hand, a tiny piece of titanium that would close the vessel permanently. This was the moment. If he placed it wrong, if he missed any branches, if the vessel tore further during clipping, Isabella would bleed out on the table. If he succeeded, she had a chance. Just a chance. But sometimes that was enough. Marcus positioned the clip, his hands absolutely steady despite the adrenaline flooding his system. 20 years of training, thousands of hours of practice, all of it coming down to this single moment, this single movement, this single decision. He closed the clip. The bleeding stopped. Vitals stabilizing, Park called out. Marcus could hear the relief in his voice. ICP dropping. 28, 23, 20. BP's holding steady, heart rate's coming down. Marcus stepped back from the table, his legs suddenly weak. They weren't done. They still had to remove all the clotted blood, close the dura, replace the bone flap, close the scalp. Hours of work remained. But they'd cleared the biggest hurdle. They'd stopped the bleeding. They'd given Isabella Navarro her chance. Good work, everyone, Marcus said, his voice rough. Now let's finish this and get her to recovery. She's got a business deal to close in. He glanced at the clock. 7 hours. No one laughed at the grim joke. But they all went back to work with renewed energy, each person playing their part in the long process of putting Isabella back together. And in the waiting room, James Carter sat with his head bowed, unaware that the worst was over. Unaware that the woman he loved had just survived something that should have killed her. Unaware that when she woke up, if she woke up, everything would be different. The surgery had taken 6 hours. 6 hours of meticulous dissection, careful removal of blood clots, painstaking reconstruction of Isabella's shattered skull. When Marcus finally emerged from OR3 at 6:47 a.m., his scrubs were soaked with sweat, his hands trembling from exhaustion and adrenaline crash, and his eyes burned from staring through the surgical microscope for so long. James leaped from his chair the moment he saw Marcus approaching. Did she? She's alive, Marcus said, and watched the man's knees nearly buckle with relief. The surgery went as well as could be expected. We stopped the bleeding, removed the blood clots, and relieved the pressure on her brain. She's being moved to the neuro ICU now. Can I see her? Marcus nodded slowly. Yes. But Mr. Carter, I need you to understand what you are about to see. Isabella is on a ventilator. A machine is breathing for her. She has tubes and monitors everywhere. Her head is bandaged, and there will be significant swelling. She looks worse than she did before surgery, and that's normal. The next 72 hours are critical. We need to see if her brain will recover from the trauma. But she'll wake up, right? James's voice cracked with desperation. You said the surgery went well. I said it went as well as could be expected. Marcus's tone was gentle but firm. The truth is, we won't know the extent of the damage until if she wakes up. Right now, we wait. We watch. And we hope. 20 minutes later, James stood at Isabella's bedside in the neuro ICU, and his heart broke into pieces. The vibrant, beautiful woman who'd sat beside him in the car just hours ago was gone, replaced by this pale, fragile creature surrounded by machines. The ventilator hissed rhythmically, forcing air into her lungs. An IV pump clicked steadily, delivering medications. Monitors beeped and chirped, displaying numbers that James didn't understand, but knew were the difference between life and death. Her head was wrapped in white bandages, so much gauze that he could barely see her face. What he could see was swollen and bruised, her eyes taped shut, a breathing tube protruding from her mouth. Her right hand, the one he'd held 1,000 times, lay limp on the bed, an IV line taped to her wrist. Bella, he whispered, taking that hand carefully, afraid he might hurt her. I'm so sorry. This is all my fault. I should have seen that truck. I should have... His voice broke. Please wake up, please. The machines beeped their indifferent response. Marcus made rounds at 8 a.m., running on caffeine and muscle memory. He'd been awake for 26 hours straight, but that was nothing unusual. The hospital was his home more than his apartment had ever been, especially since the divorce. Isabella Navarro, post-op day 0 from emergency craniotomy, Dr. Chen reported as they stood outside Isabella's room. Vitals are stable. ICP is holding at 18. She's on moderate ventilator support. Propofol for sedation. So far, so good. Glasgow Coma Scale? Marcus asked, reviewing her chart on the tablet. 6, same as admission. Marcus frowned. She should be higher than that by now. The bleeding stopped, the pressure's down. Why isn't she responding better? Marcus, it's been less than 12 hours since a massive head trauma, Chen said reasonably. Her brain needs time to recover from the shock. Or it's already too damaged to recover. Marcus didn't look up from the chart. Secondary injury from the swelling, ischemic damage, diffuse axonal injury we didn't see on the scan. Take your pick. You're catastrophizing. I'm being realistic. Marcus handed back the tablet and walked into Isabella's room. James looked up from his bedside vigil, his eyes red-rimmed and hollow. He'd been there all night, Marcus realized. Hadn't eaten, hadn't slept, probably hadn't even gone to the bathroom unless forced. How is she? James asked, the same question he'd asked every nurse who'd entered for the past 3 hours. Marcus approached the bed, pulling his penlight from his pocket. I need to do a neurological exam. Can you step back for a moment? James reluctantly released Isabella's hand and moved aside. Marcus gently peeled back the tape, covering her right eye, lifting the lid. He shined his light into her pupil, watching for the constriction that would indicate normal brain function. The pupil remained sluggish, barely reactive. He checked the left eye, even worse, barely any reaction at all. Marcus's jaw tightened. He moved to her hands, pressing hard on her nail beds to test for pain response. In a normal person, even an unconscious one, the body would pull away from pain. Isabella's fingers twitched slightly on the right side, but the left remained completely still. What does that mean? James asked, reading the concern on Marcus's face. Dr. Reid, what's wrong? Marcus replaced Isabella's hand on the bed, his mind already racing through possibilities. Increased intracranial pressure? New bleeding? Stroke? Brain swelling beyond what they could control? I need to get another CT scan, now. But you just operated on her, which is exactly why we need to see what's happening in there. Marcus was already at the door, calling for nurses. Get her down to radiology. I want a non-contrast head CT stat. And Page Neuro, tell them we might be going back to the OR. The next 30 minutes were a blur of activity. Isabella was disconnected from the room monitors, reconnected to transport monitors, wheeled through corridors to the radiology department while Marcus walked alongside, watching her vitals like a hawk. Every fluctuation in her blood pressure, every change in her oxygen saturation, sent his mind spiraling through worst-case scenarios. The CT scanner hummed and whirred as Isabella's head was imaged, slice by slice, cross-section by cross-section. Marcus stood in the control room, his arms crossed, his eyes locked on the monitor as the images appeared. And there it was, his worst fear, rendered in black and white. Rebleed, he said flatly. Small, but it's there. Right posterior temporal. And look at the midline. She's shifting again. The brain's swelling more than we anticipated. The radiologist leaned forward, adjusting the image contrast. That bleeding wasn't there on the post-op scan 4 hours ago. It's new. Which means a vessel we missed is still leaking, or the trauma caused delayed rupture of a weakened artery. Marcus rubbed his face, feeling the stubble scratch his palms. Either way, she's getting worse, not better. Dr. Chen appeared at his shoulder, studying the images. We can't take her back to surgery, Marcus. She's too unstable. Another craniotomy this soon would kill her. So would letting her brain swell until it herniates out the bottom of her skull. Marcus shot back. What do you suggest, Patricia? That we just watch her die? I'm suggesting we give the medical management a chance to work. max out the osmotic therapy, elevate the head of the bed, keep her deeply sedated to reduce metabolic demand. We've got options before we resort to more surgery. Marcus wanted to argue, wanted to insist on action, on doing something rather than waiting. But Chen was right, and he knew it. Taking Isabella back to the OR now, in her weakened state, with her brain already traumatized from one major surgery, would almost certainly kill her. But watching and waiting while she deteriorated wasn't much better. "Fine," he said through gritted teeth, as Marcus walked away, heading for the doctor's lounge where he could finally grab a cup of coffee and maybe 10 minutes of rest. His phone buzzed. A text from his ex-wife. "Sarah asked about you again. I told her you were too busy with work to call. Guess I was right, as always." Marcus stared at the message, feeling the familiar guilt twist in his gut. His daughter was 7 years old and barely knew him. His career had cost him his marriage, his family, any semblance of a normal life. And here he was, about to spend another sleepless night fighting to save a stranger, while his own child wondered why Daddy never had time for her. He typed a response. "Tell Sarah I love her. I'll call tomorrow." He knew he probably wouldn't. There was always another emergency, another patient, another reason why tomorrow never came. The hospital had long since stopped being a place he worked and become the only place he truly existed. Marcus poured his coffee and stood at the window, watching the sun rise over Boston. Somewhere in this building, Isabella Navarro was dying by increments. Her brain swelling against the confines of her skull, her body fighting a battle she might not win. And there was nothing Marcus could do except wait and watch and hope that the medications would work, that the swelling would stop, that somehow, impossibly, she would survive. In medicine, miracles were rare. Marcus had learned that lesson early in his career. But sometimes, just sometimes, the impossible happened. Sometimes patients who should have died lived. Sometimes the body's capacity for healing exceeded every prediction, every statistic, every reasonable expectation. Marcus drained his coffee and headed back to the ICU. He wouldn't sleep, not while Isabella was still in danger, not while there was even the smallest chance he might be needed, because that was who he was. For better or worse, for his destroyed marriage and estranged daughter, for all the personal costs and sleepless nights and endless guilt, he was a doctor. And doctors didn't give up, even when hope was a fragile, dying thing. 48 hours after the surgery, Isabella Navarro was still alive. Barely. Marcus stood at her bedside at 3:17 a.m., reviewing the hourly neurochecks that told a story of slow, inexorable decline. Her intracranial pressure had climbed from 18 to 24 to 29. Her pupils were becoming more sluggish with each assessment. Her body temperature was spiking despite cooling measures, her brain's thermostat broken by the trauma. "We're losing her," he said quietly to the night nurse. Not a question, a statement of fact. The nurse, a veteran named Sandra who'd seen more death than most soldiers, nodded. Dr. Chen said to call her if the ICP hit 30. "We're 1 point away." "Don't call Chen. She needs sleep." Marcus pulled up a chair and sat down, which he almost never did during rounds. He was exhausted to his bones, running on his 4th consecutive night of maybe 2 hours of sleep. His ex-wife had called 3 times. His daughter's school had left a voicemail about a parent-teacher conference he'd missed. The hospital administrator wanted to discuss his concerning pattern of overtime hours. None of it mattered. Not when Isabella Navarro was dying in front of him, and he was out of options. James had finally gone home to shower and change clothes. Isabella's mother, Carmen Navarro, had arrived from Madrid that morning, an elegant woman in her 50s, whose composure had shattered the moment she saw her daughter. She'd held Isabella's hand and spoken to her in rapid Spanish, words that Marcus didn't understand, but that clearly came from a mother's breaking heart. Now Carmen was in the family waiting room, probably praying, probably bargaining with God the way everyone did when medicine failed them. Marcus looked at Isabella's face, still swollen but beautiful even in crisis. 28 years old, her whole life ahead of her, a career she'd built through ambition and intelligence, a man who loved her, a mother who'd flown across an ocean to be with her, all of it hanging by a thread that was fraying with every hour. "What am I missing?" he muttered to himself. "What piece of the puzzle am I not seeing?" He'd reviewed her case 100 times. The initial trauma, the surgery, the post-op bleeding, the aggressive medical management. Everything had been done by the book. But the book was wrong, or at least incomplete. Because Isabella wasn't responding the way she should. Marcus pulled out his phone and started scrolling through medical journals. He did this sometimes when he was stuck. Read case reports, looking for that one obscure detail that might spark an idea. Most of the time it was useless. But sometimes, just sometimes, you found something. Traumatic brain injury, refractory cerebral edema, treatment-resistant intracranial hypertension. He read for 20 minutes, his eyes burning, the words starting to blur together. And then he found it. A case report from a hospital in Germany, published just 6 months ago. A young woman with similar injuries, similar lack of response to standard treatment. The German team had tried something experimental, a combination of targeted hypothermia and a new osmotic agent that wasn't yet approved in the United States. But that showed promise in reducing brain swelling when everything else failed. Marcus sat up straighter, his exhaustion forgotten. The hypothermia part they could do. They had the equipment. But the osmotic agent was the problem. It wasn't FDA approved, wasn't available through normal channels. Getting it would require cutting through red tape, calling in favors, possibly bending rules that were meant to protect patients, but sometimes just got in the way of saving them. He looked at Isabella, at the monitors showing her brain slowly being crushed by pressure, at the ventilator breathing for her because her brainstem was too compressed to do the job properly. "Screw the rules," he whispered. Marcus stood and walked out of the ICU, pulling out his phone. He scrolled through his contacts until he found the name he was looking for. Dr. Heinrich Weber, a neurosurgeon he'd met at a conference 3 years ago in Berlin. They'd spent an evening drinking beer and discussing the frontiers of brain trauma treatment. If anyone could help him get access to that experimental drug, it would be Heinrich. It was 9:23 a.m. in Germany. Marcus called. "Yeah? Hello?" The voice was groggy, confused. "Heinrich, it's Marcus Reid, from Boston. I'm sorry for calling so early." "Marcus." The grogginess vanished, replaced by warmth. "My friend, it has been too long. How are you? I need your help." Marcus launched into Isabella's case, speaking quickly, precisely, giving Heinrich all the relevant details. "I read your case report on the use of hypertonic lactated Ringer's solution combined with therapeutic hypothermia. The patient in your report, she survived, yes?" "She did," Heinrich confirmed. "Complete neurological recovery. It was remarkable. But Marcus, you know this treatment is still experimental. We only tried it because we had nothing else to lose." "I have nothing else to lose," Marcus said. "This patient is dying, Heinrich. Standard treatment isn't working. If I don't try something different, she'll be dead by tomorrow. There was a long pause. Then, "What do you need from me?" "The protocol. Every detail. Drug dosages, cooling rates, monitoring parameters. And if possible, a supply of the hypertonic lactated ringers. I know it's not approved here, but I can have it shipped to you." Heinrich interrupted. "Express delivery. It will arrive tonight, your time. And Marcus, I will send you everything. My notes, our protocols, all of it. But you must understand, this is highly experimental. If it goes wrong, if the patient has complications, you will be held responsible." "I know." Marcus's voice was steady. "But if I don't try, and she dies anyway, I'll be responsible for that too. At least this way, she has a chance. Then I wish you luck, my friend. Call me if you need guidance during the treatment. I will make myself available." Marcus hung up and allowed himself one moment of hope before reality crashed back in. He still had to get approval from the hospital ethics committee. He had to get consent from Isabella's family. He had to convince his colleagues that this wasn't reckless desperation, but calculated risk based on emerging evidence. And he had to do it all in the next 6 hours, before Isabella's brain swelled beyond the point of no return. At 9 a.m., Marcus convened an emergency meeting in the small conference room adjacent to the ICU. Present were Dr. Patricia Chen, the hospital's chief of neurosurgery, Dr. Robert Yamamoto, the ethics committee chair, Dr. Lisa Martinez, and the ICU medical director, Dr. James O'Brien. Marcus stood at the head of the table, a stack of printed research papers in front of him. He looked like hell. Unshaven, eyes bloodshot, his white coat wrinkled and coffee-stained. But his voice was clear and strong as he presented Isabella's case and his proposed treatment. "She's dying," he said bluntly. "Her ICP is 29 and climbing despite maximal medical therapy. We've tried everything in our treatment algorithm, and she's not responding. I'm proposing we try a new approach based on recent European research." He distributed copies of the German case report. Combination of aggressive therapeutic hypothermia, cooling her core temperature to 33 degrees Celsius, along with hypertonic lactated ringers solution that has shown promise in reducing cerebral edema when standard osmotic therapy fails. Dr. Yamamoto, a stern man in his 60s, frowned as he read. "This treatment isn't FDA approved. We don't have protocols for it. And this case report represents exactly one successful case. That's not evidence, Reid. That's an anecdote." "It's more than we have now," Marcus shot back. "Right now, our evidence says she dies. This gives her a chance." "A chance at what?" Dr. Martinez, the ethicist, asked. "Even if she survives, what's her likely neurological outcome? Severe disability? Vegetative state? Are we doing this for her benefit or because we can't accept failure?" The question hit Marcus like a punch. He thought about his ex-wife's accusations, about his need to save everyone, about whether his drive to help patients was actually about them or about his own ego, his own inability to walk away from a fight. "I don't know," he admitted, and the honesty in his voice seemed to surprise everyone. "I don't know if she'll wake up. I don't know if she'll be able to talk or walk or recognize her mother. But I know that right now, at this moment, she's alive. Her heart is beating, her body is fighting. And as long as she's fighting, we should fight with her." "Marcus," Dr. Chen said gently, "sometimes fighting just prolongs suffering. Sometimes the most compassionate thing we can do is step back and let nature take its course." "Nature's course is death," Marcus said. "That's always nature's course. Everything alive is dying from the moment it's born. But we don't just accept that. We fight it. We push back against entropy and decay and death. That's what medicine is. That's what we do. He looked around the table, meeting each person's eyes. And yes, sometimes we lose. Sometimes we fight and the patient dies anyway. But at least we tried. At least we gave them every possible chance. Dr. O'Brien had been silent throughout the discussion, but now he spoke. If we approve this and something goes wrong, the hospital's liability— Forget the liability, Marcus interrupted. I'll take full responsibility. Put it in writing. This is my decision, my treatment plan. If it fails, it's on me. Marcus, you can't. Chen started. Yes, I can, and I will. Marcus turned to Dr. Martinez. What does the family say? Do they want us to try everything? Or are they ready to let her go? Dr. Martinez consulted her tablet. The mother, Carmen Navarro, has stated she wants everything possible done to save her daughter. The boyfriend, James Carter, agrees. They're both willing to accept the risks of experimental treatment if it offers any hope. Then we have consent, Marcus said. We have a family that wants to fight. We have a patient who's young and otherwise healthy, whose body still has the capacity to heal if we can just get the swelling under control. What we don't have is time. That shipment from Germany arrives at 6 p.m. We need approval to proceed by then. The room fell silent. Marcus could see the internal calculations happening, weighing risks and benefits, medical ethics and hospital politics, the desire to help against the fear of making things worse. Finally, Dr. Yamamoto spoke. I'll approve it, with conditions. You monitor her constantly. Any sign of complications, seizures, cardiac issues, worsening neurological status, and we stop immediately. This is one attempt, Reid. If it doesn't work, we transition to comfort care. Agreed? Marcus nodded. Agreed. Then let's hope this German miracle cure of yours works, Yamamoto said, standing. Because if it doesn't, that young woman in there is going to die, and we'll all have to live with wondering if we did the right thing. As the meeting broke up, Marcus remained seated, suddenly overwhelmed by the weight of what he'd just committed to. He was about to try an experimental treatment that had been successfully performed exactly once, on a patient who was already critically ill, with approval that could be revoked at any moment if things went wrong. Dr. Chen sat down beside him. Marcus, are you sure about this? No, he admitted, but I'm sure about doing nothing. And between those two options, I'll take action every time. Even if it fails? Even then. Marcus looked at her. Because someday, Patricia, one of these experimental treatments is going to work. One of these desperate last-ditch efforts is going to save someone who would have died otherwise. And maybe that someone is Isabella Navarro. Maybe tonight we make history. Or maybe we just delay the inevitable by a few more days. He shrugged. Either way, we tried. At 6:14 p.m., the overnight delivery arrived from Germany. Marcus stood in the receiving area, signing for the package with hands that trembled slightly. Inside the insulated container were vials of hypertonic lactated Ringer's solution, packed in ice, along with Heinrich's detailed handwritten notes on the treatment protocol. Marcus carried it back to the ICU like it was precious cargo. Which it was. It was hope, crystallized and bottled, flown across an ocean on the gamble that science and stubborn determination could cheat death one more time. All right, Isabella, Marcus said as he entered her room, where Carmen sat holding her daughter's hand and James stood at the window, staring out at the darkening Boston sky. Let's see if we can pull off a miracle. He began preparing the infusion, The ICU had never felt more like a battlefield. Marcus stood at Isabella's bedside, surrounded by equipment that would have looked at home in a science fiction movie. Cooling blankets wrapped her body, circulating ice-cold water to lower her core temperature. Temperature probes monitored 6 different sites: brain, esophagus, bladder, skin. A new IV line delivered the experimental hypertonic lactated Ringer's solution, its rate carefully calculated based on Heinrich's protocols and Isabella's weight. Core temp is 36.2 and dropping, announced Sarah, the ICU nurse who'd volunteered to stay for the extended shift. Target is 33 degrees Celsius, correct? Correct, Marcus confirmed, his eyes scanning the bank of monitors. But we need to go slow. Too fast and we risk cardiac arrhythmias. Drop her temp by 1 degree per hour, no faster. Carmen Navarro sat in the corner, rosary beads wrapped around her fingers, her lips moving in silent prayer. She'd aged 10 years in the past 2 days. James stood beside her, one hand on her shoulder, his own face drawn and hollow. They'd been given the consent forms, had listened to Marcus explain the risks in careful detail. Seizures, cardiac arrest, kidney failure, brain damage beyond what Isabella already had, death. They'd signed anyway, because what choice did they have? Dr. Reid? Dr. Chen appeared in the doorway. I'll be staying too. Someone needs to keep an eye on you before you collapse. Marcus almost smiled. I'm fine. You've been awake for 62 hours. You're not fine, but you're too stubborn to admit it, so I brought coffee. She handed him a large cup from the hospital cafeteria. And I called your ex-wife. Told her you were in the middle of a critical case and would call Sarah tomorrow. Marcus's jaw tightened. You didn't need to do that. Yes, I did. Because you wouldn't have. And that little girl deserves to know her father is thinking about her, even when he's trying to save the world one patient at a time. Before Marcus could respond, the monitor alarms shrieked to life. Isabella's blood pressure had dropped suddenly from 120/70 to 85/50 in seconds. Her heart rate spiked to 140. She's going into shock, Sarah called out, already reaching for medication vials. Pressure's still dropping, 70/40. Marcus was at the bedside in 2 strides, his exhaustion forgotten, adrenaline flooding his system. Stop the cooling. Now. She's hypothermic too fast. Her body can't compensate. His hands moved rapidly, checking IV lines, adjusting medication rates. Give me a bolus of normal saline, wide open, and get the crash cart ready. ICP's spiking, Chen warned, reading the monitor. 32, 34. Marcus, the pressure drop is making her brain swell faster. It was the nightmare scenario. The treatment that was supposed to save Isabella was killing her instead. Marcus's mind raced through options, calculating risks and benefits at lightning speed. If they stopped the treatment, the swelling would continue unchecked, and she'd die. If they continued, her blood pressure would bottom out and she'd die. And if they tried to fix the blood pressure with pressors, it might worsen the brain swelling, and she'd die. 3 different paths to the same destination. No, Marcus said aloud. I'm not losing her. Sarah, give me phenylephrine. Start low dose and titrate up. We need to support her pressure while her body adjusts to the temperature change. Chen, increase the osmotic therapy. Give her another dose of mannitol now, and restart the cooling, but cut the rate in half. We go slower. Marcus, this is too aggressive, Chen protested. We're throwing everything at her simultaneously. How will we know what's working and what's making things worse? We won't, Marcus admitted. but we're out of time for careful, controlled interventions. It's all or nothing now. The next 20 minutes were chaos, orchestrated by experience. Medications flowed through IV lines. The cooling blankets resumed their work at a gentler pace. Alarms rang and were silenced as vital signs fluctuated wildly. Carmen's prayers grew louder, her voice breaking. James had turned away from the scene, his shoulders shaking. And then, slowly, impossibly, Isabella's blood pressure began to rise. 85 over 50, 90 over 60, 100 over 65. She's stabilizing, Sarah said, disbelief coloring her voice. Heart rate's coming down, 120, 110, 100. Marcus watched the ICP monitor like a hawk. 34, 33, 31, 29, 26. The swelling's decreasing, Chen whispered. Marcus, it's actually working. Marcus didn't allow himself to celebrate. Not yet. They'd cleared one hurdle, but the night was long and full of opportunities for disaster. What's her core temp now? 35.4. We've slowed the cooling as ordered. Good. Maintain current rates on everything. And somebody page respiratory. I want blood gases every 2 hours. We need to make sure her oxygen levels stay optimal. He finally stepped back from the bedside, his legs suddenly weak. The adrenaline crash hit him hard, and he had to grab the counter to steady himself. Chen was there immediately, her hand on his arm. Sit down before you fall down, she ordered. Can't. Need to. You need to sit down, drink that coffee, and let your body process what just happened. Chen guided him to a chair. The nurses can handle monitoring for 10 minutes. Sit. Marcus sat. More because his legs gave out than because he agreed with her. He sipped the coffee, which had gone lukewarm, and watched Isabella's monitors from across the room. The numbers were holding steady. Not great, but stable. It was more than they'd had an hour ago. Dr. Reid. Carmen approached slowly, her English heavily accented but clear. What you did just now, you saved her life again, yes? Marcus shook his head. We're not out of the woods yet, Mrs. Navarro. This treatment needs to work for the next 24 to 48 hours. We need the swelling to continue decreasing, and we need to do it without causing new complications. It's still very touch and go. But she is alive now, when she was dying before. Carmen's eyes filled with tears. You gave us time. You gave her a chance. In Spain, we have a saying, mientras hay vida, hay esperanza. While there is life, there is hope. That's a good saying, Marcus said quietly. Carmen took his hand in both of hers. My Isabella, she is fighter like you. Strong, stubborn. She does not give up. The tears spilled over. When she was a little girl, she had meningitis. The doctor said she would die. But she fought, and she lived. She always fights. Marcus felt something crack in his chest, some wall he'd built to keep emotions out while he worked. Then we'll fight with her, Mrs. Navarro. I promise you that. The hours crawled by. Midnight came and went. Marcus made rounds on his other patients, a teenage boy with a skull fracture from a skateboarding accident, a middle-aged woman with a brain tumor, an elderly man recovering from a stroke. But his mind never left Isabella's room. Every half hour, he checked on her. Every hour, he reviewed her labs and vital signs, looking for any sign that things were going wrong. At 2 a.m., he was back at her bedside when James approached him. The younger man looked terrible, pale, exhausted, guilt-ridden. Can I ask you something, doctor? Of course. Why are you doing this? James gestured at the equipment, the medications, the elaborate treatment setup. I mean, I know it's your job, but this This is something more. You're killing yourself to save her. Why? Marcus was quiet for a long moment, watching Isabella's chest rise and fall with the ventilator's rhythm. Do you know what the worst feeling in the world is, Mr. Carter? Losing someone you love, James said immediately. No. Marcus's voice was soft but certain. The worst feeling is knowing you could have done more. Knowing that there was something you could have tried, some option you didn't explore, some risk you didn't take because you were afraid or tired or following the rules, and then living with that knowledge for the rest of your life. He turned to look at James. I've lost patience, more than I can count. But the ones that haunt me aren't the ones I fought for and lost. They're the ones where I wonder if I gave up too soon. If I'd pushed a little harder, tried a little longer, maybe. He shook his head. With Isabella, I'll never have to wonder. If she dies, it won't be because we didn't try everything. It won't be because I took the safe path instead of the right one. You're a good doctor, James said. I'm a stubborn doctor, Marcus corrected. There's a difference. Good doctors follow evidence and protocols. I follow instinct and desperation. He smiled grimly. Fortunately for Isabella, sometimes that works. At 4 a.m., Sarah called Marcus back to the room urgently. Her pupils. Look at her pupils. Marcus grabbed his pen light, his heart pounding. He lifted Isabella's eyelid and shined the light. The pupil constricted immediately, sharply, normally. He checked the other side. The same response. They're reactive. He breathed. Both of them, for the first time since the surgery. And look at this. Sarah squeezed Isabella's hand. The fingers curled slightly in response. Sarah moved to the other side, tested the left hand. That too showed movement. She's getting better, Chen said from the doorway, where she'd been observing. Marcus, the treatment is actually working. Marcus allowed himself a smile. Small, cautious, but genuine. Don't jinx it. We've still got a long way to go. But for the first time since Isabella Navarro had crashed through the trauma bay doors, Marcus Reid felt something he'd almost forgotten how to feel. Hope. Not the desperate, grasping hope of a losing battle, but real, solid hope based on objective improvement. Her brain was healing, the swelling was decreasing, the experimental treatment was succeeding where everything else had failed. At 6 a.m., as the sun began to rise over Boston and the night shift prepared to hand off to day shift, Marcus stood at the ICU window, coffee in hand, watching the city wake up. Behind him, Isabella slept in her medically induced coma, her body fighting its way back from the edge of death. Her mother dozed in the chair, finally too exhausted to keep praying. James had gone to get breakfast, the first food he'd eaten in 24 hours. Dr. Chen joined Marcus at the window. You should go home, get some real sleep. Soon, Marcus said. I want to see her through the next 12 hours, make sure the improvement holds. It will hold. You've done everything possible. Let the day team handle monitoring. You're not superhuman, Marcus, even if you like to pretend you are. Marcus sipped his coffee, not responding. The truth was, he didn't know how to leave. Didn't know how to walk away from Isabella's bedside when her life still hung in the balance, even if that balance was tipping in the right direction. This wasn't about being superhuman. It was about being responsible, about seeing through what he'd started, about not failing another person who'd trusted him to keep them alive. 12 more hours, he repeated. Then I'll go home. Chen sighed, but didn't argue. She knew Marcus well enough to know that arguing was pointless when he'd made up his mind. Fine. but at least eat something. You're useless to your patients if you collapse from hypoglycemia." "Yes, Mom," Marcus said with the ghost of a smile. As Chen walked away, Marcus pulled out his phone and opened his messages. His daughter had sent him a video the night before. Sarah on her swing set, laughing, calling, "Watch me, Daddy. Watch how high I can go." He'd been too busy to watch it then. He watched it now and felt his throat tighten. 7 years old, and she still wanted him to watch her. Still believed that Daddy would have time for her, even when Daddy never did. "I'm sorry, sweetheart," he whispered to the phone screen. "I'm trying. I'm really trying." But even as he said it, he knew it was a lie. He wasn't trying to be a better father. He was trying to be a better doctor. And in his world, there was never room for both. 72 hours after the experimental treatment began, Isabella Navarro was still alive. More than alive, she was improving. Her intracranial pressure had stabilized at 15 millimeters of mercury. Her pupils were brisk and equal. Her body temperature had been gradually warmed back to normal. The swelling in her brain had decreased enough that Marcus had begun discussing with the team about weaning her from the ventilator. But Marcus knew better than to celebrate too early. In his experience, traumatic brain injury patients had a cruel habit of improving just before they crashed catastrophically. The brain was treacherous territory. It could fool you into thinking the battle was won, and then suddenly turn the tide with a seizure, a new bleed, an infection, any of 100 complications that could erase all progress in minutes. It was 6 a.m. on day 4 when the alarm sounded. Marcus was in the doctor's lounge, finally taking Chen's advice and trying to get an hour of sleep on the lumpy couch. The overhead speaker jolted him awake. "Code blue, Neuro ICU, bed 7. Code blue, Neuro ICU, bed 7. Bed 7. Isabella's bed. Marcus ran. He didn't bother with the stairs. He vaulted down them 3 at a time, his heart hammering, his mind already cataloging possibilities. Cardiac arrest, seizure, pulmonary embolism, stroke. He burst through the ICU doors to find controlled chaos around Isabella's bed. "She's seizing," Sarah reported, her voice tight with controlled panic. "Started 30 seconds ago. Grand mal. I've given 2 milligrams of lorazepam IV. Oh, no response." Marcus pushed through to the bedside. Isabella's body was rigid, her back arched, her arms and legs jerking violently against the restraints they'd placed to prevent her from pulling out her lines. Her eyes were rolled back, showing only whites. Foam flecked her lips where the breathing tube entered her mouth. "Give another 2 milligrams of lorazepam," Marcus ordered, his hands checking her pupils with his penlight even as she seized. Fixed and dilated, not responding to light. "And get me phosphonatorone loaded now. This is status epilepticus." Status epilepticus. A seizure that wouldn't stop. The brain essentially short-circuiting, neurons firing in chaotic patterns that could cause permanent damage or death if not controlled quickly. Every second of seizing was brain cells dying, structures being destroyed by the electrical storm ravaging Isabella's already traumatized brain. "Lorazepam's in," Sarah said. "Still seizing." "Phosphonatorone," Marcus demanded. "Loading now. Will take 2 minutes to infuse." 2 minutes. 120 seconds of Isabella's brain tearing itself apart. Marcus watched the monitors helplessly. Her heart rate was climbing, 150, 160, 170. Her blood pressure spiking. Her oxygen saturation starting to drop as the seizure interfered with her breathing despite the ventilator. "Come on, Isabella," he muttered. "Fight it. Fight through it." Carmen appeared in the doorway, her face white. What's happening? What's wrong with my daughter? She's having a seizure, Mrs. Navarro. We're treating it. Please, you need to step outside. Marcus didn't take his eyes off Isabella, but his voice was firm. No, I stay with her. Carmen. James materialized beside her, his voice gentle but urgent. Let them work. Come on. He guided her back to the waiting area, her protests fading down the hallway. The phosphine twin finished infusing. Marcus counted seconds, watching Isabella's body, waiting for the medication to take effect. The jerking continued. Her face was turning dusky, cyanotic, her body not getting enough oxygen despite maximum ventilator support. She's not responding, Sarah said, stating the obvious because someone had to. Dr. Reid, we need to go to third-line agents. Propofol drip, Marcus ordered. Start high dose. And page anesthesia. If this doesn't work, we're putting her in a barbiturate coma. A barbiturate coma. The last resort for stopping seizures, essentially shutting down all brain activity to give the neurons a chance to reset. It was dangerous. Patients didn't always wake up from it. But it was better than letting the seizure continue unchecked. The propofol went in. Another agonizing minute passed. And then, finally, mercifully, Isabella's body began to relax. The jerking slowed, then stopped. Her muscles went limp. The monitors showed her heart rate declining. 170, 160, 140, 120. Seizures breaking, Sarah announced, relief evident in her voice. Marcus didn't relax. Get me a stat head CT and an EEG. We need to see what her brain activity looks like. I want to know if there's ongoing subclinical seizure activity. He checked Isabella's pupils again. Still sluggish, but they were responding now. He squeezed her hand. No response. He ran his thumbnail hard along the sole of her foot. A painful stimulus that should produce a reflex. Nothing. She's more unresponsive than before, Dr. Chen observed, having arrived during the crisis. Marcus, the seizure may have caused additional damage. Marcus's jaw clenched so hard his teeth ached. They'd been so close. Isabella had been improving, had been on track to survive, maybe even recover. And now this. A complication that could undo everything. That could leave her in a persistent vegetative state even if she survived. Or worse, it could kill her outright through brain herniation or another catastrophic bleed. Get that CT, he repeated, and increase her anti-epileptic coverage. I want her on 3 different seizure medications. We can't let this happen again. The next hour was a blur of tests and scans. The head CT showed no new bleeding, which was the one piece of good news. But the EEG revealed something worrying. Although she wasn't actively seizing anymore, her brain waves were chaotic, unstable, threatening to tip back into seizure territory at any moment. It's like her brain is teetering on the edge of a cliff, the neurologist, Dr. Amanda Foster, explained as she reviewed the EEG with Marcus. We've got her stabilized for now. But this seizure lowered her threshold. She could seize again at any time, and the more she seizes, the harder it becomes to stop them. So what do you recommend? Marcus asked, though he suspected he already knew the answer. Barbiturate coma, Foster said. Put her in a medically induced burst suppression pattern for 48 to 72 hours. Give her brain a chance to reset, to heal from the seizure activity. It's risky, but less risky than letting her continue like this. Marcus looked through the window at Isabella's room, where Carmen had returned and was holding her daughter's hand, speaking softly in Spanish. James stood at the window, his forehead pressed against the glass, his shoulders hunched in defeat. 4 days ago, Marcus had fought to save Isabella's life during surgery. 3 days ago, he'd gambled on an experimental treatment. Now he was being asked to put her in a coma so deep that her brain activity would be almost flatlined, walking the razor's edge between therapeutic intervention and causing irreversible harm. "Do it," he said. "Start the pentobarbital. And Foster? Monitor her like a hawk. Any signs of instability, any problems, I want to know immediately." "You'll be the first call," Foster assured him. Marcus walked to Isabella's room to explain the new plan to her family. This was the part of medicine he hated. Delivering bad news to people who had already been through hell, telling them that things had gotten worse instead of better, watching hope drain from their eyes. Carmen looked up as he entered. "Doctor, what has happened?" Marcus pulled up a chair and sat facing her and James, his voice gentle but honest. "Isabella had a severe seizure this morning. We were able to stop it, but her brain is now unstable. We need to place her in a very deep coma, deeper than she's been, to prevent more seizures and give her brain time to recover." "Deeper coma?" Carmen's English was strained by stress. What does this mean?" "It means we're going to use a powerful medication to essentially shut down most of her brain activity for the next 2 to 3 days. During that time, she'll be completely unconscious, completely dependent on machines. It's frightening to watch, but it's necessary to protect her brain." "And when you wake her up?" James asked, his voice hollow. "Will she still be Isabella?" Marcus met his eyes. "I don't know. The seizure may have caused additional damage. We won't know the extent until we wake her up and see how she responds. I'm sorry I can't give you better answers." Carmen's hand tightened on her rosary. "You saved her before. 2 times. 3 times now. You'd do it again. Mrs. Navarro, I'm not God. I'm just a doctor. And sometimes, no matter what we do—" "You save her," Carmen interrupted, her voice fierce. "You do not give up on my Isabella. She is fighter. You are fighter. Together, you save her." Marcus felt the weight of her faith in him like a physical burden. He wanted to tell her not to hope, not to expect miracles, that medicine had limits, and Isabella had already exceeded most of them. But looking at Carmen's face, this mother who'd flown across an ocean, who'd sat vigil for days, who refused to accept defeat, he couldn't bring himself to take away her hope. "We'll do everything we can," he said instead. "I promise you that." The barbiturate coma began at 10 a.m. Marcus stayed in the room as the pentobarbital infused, watching Isabella's EEG pattern gradually flatten into the burst suppression pattern they wanted. Brief bursts of brain activity separated by long periods of near silence. It looked like death on the monitor, and it took every ounce of his medical training not to react to it as such. "She's in deep coma now," Foster said, adjusting the medication drip. "We'll maintain this for 72 hours minimum, then gradually lighten it and see how she responds. 3 more days. 3 more days of uncertainty, of watching and waiting, of hoping that when they woke Isabella Navarro from this artificial sleep, she would still be in there somewhere. 3 more days of Marcus living at the hospital, surviving on coffee and adrenaline, neglecting his daughter and his own health in service of a patient who might never wake up. Dr. Chen found him at 2 p.m., standing at the ICU window, staring at nothing. "You need to go home, Marcus. You've been here for 5 straight days." "I'll go home when she wakes up." "And if she doesn't wake up?" The question hung in the air between them. Marcus didn't answer because he didn't have an answer. Because the possibility that Isabella might not wake up, that all of this effort, all of this risk, all of this hope might be for nothing, was too terrible to contemplate. "She'll wake up," he said finally. "She has to." But even as he said it, he knew that needing something to be true didn't make it true. He'd learned that lesson the hard way. In a marriage that had crumbled despite his desperate need to save it, with a daughter who'd grown distant despite his love for her, with countless patients who died despite his best efforts. Want and need had nothing to do with outcomes, only the cold mathematics of biology and chance. Marcus pulled out his phone and finally returned his daughter's call. She answered on the second ring. "Daddy?" "Hey, sweetheart. I'm sorry I've been so busy." "Are you saving someone?" Sarah asked, her 7-year-old voice full of innocent understanding. "Mommy says you're always saving people." "I'm trying to," Marcus said, his throat tight. "There's a lady here who's very sick, and I'm trying to help her get better." "Will she get better?" "I hope so, baby. I really hope so." "I hope so too," Sarah said, "because then you can come see me. I miss you, Daddy." "I miss you too, sweetheart. So much." Marcus closed his eyes, fighting back emotions he couldn't afford to feel right now. "I love you." "Love you too. Bye, Daddy." The line went dead. Marcus stood there, holding his phone, staring at his daughter's picture on the screen. Her gap-toothed smile, her messy pigtails, her eyes that looked so much like his own. 7 years old, and already learning that Daddy's work was more important than she was. Already internalizing the lesson that would shape her own relationships, her own choices, her own life. He was failing her. He knew that. Just like he'd failed his marriage, failed every promise he'd made about work-life balance. Because at the end of the day, when forced to choose between his daughter and a dying patient, Marcus Reid always chose the patient. Maybe because patients needed him in a way his daughter didn't. Maybe because medicine gave him a sense of purpose and accomplishment that fatherhood never had. Or maybe because it was easier to love strangers than to love the people who actually knew him, who saw his flaws and failures and loved him anyway. Marcus didn't know. And right now, standing in this hospital hallway with Isabella Navarro's life hanging by a thread, he didn't have the energy to figure it out. He went back to her room, pulled up a chair, and resumed his vigil. Waiting, watching, hoping against hope that this gamble, like all the others, would somehow pay off. That somehow, this time, he could save both the patient and himself. Day 7. The morning sun streamed through the ICU windows, painting Isabella's room in gold and amber. Marcus stood at her bedside, watching the monitors as Dr. Foster gradually reduced the pentobarbital infusion. For 3 days, Isabella had existed in a state of near death, her brain activity suppressed to almost nothing. Now, slowly, carefully, they were bringing her back. If she could come back. EEG is showing increased activity, Foster reported, her eyes on the screen. "We're seeing normal sleep patterns emerging. That's a good sign, Marcus." Marcus nodded but said nothing. He'd seen too many false hopes, too many patients who showed promising signs and then never woke up. Until Isabella opened her eyes and responded to commands, he wouldn't let himself believe. Carmen and James stood on the other side of the bed, holding hands, barely breathing. They'd been here for hours, waiting for this moment. Carmen's rosary was worn smooth from constant handling. James looked like he'd aged 20 years and 7 days. "How long until we know?" James asked, his voice hoarse. Could be hours, Marcus said. Could be days. As the medication clears her system, her natural level of consciousness should emerge. We'll start testing her responses, checking if she can follow commands, if she can squeeze hands, if she can breathe on her own without the ventilator. And if she can't? Carmen asked the question no one wanted to answer. Then we reassess, Marcus said carefully. But let's not borrow trouble. Let's see what happens. The hours crawled by. Marcus performed neurological exams every 30 minutes, shining lights in Isabella's eyes, testing her reflexes, calling her name. Each time, nothing. Her body remained still. Her eyes closed, no response to any stimulus. At 2 p.m., Dr. Chen pulled Marcus aside. You've been here for 7 days straight. You need to leave, even if just for a few hours. Go home, shower, sleep in your own bed. The team can handle monitoring Isabella. I'm fine, Marcus said automatically. You're not fine. You're running on fumes and stubbornness. Chen's voice softened. Marcus, you've done everything medically possible for this patient. Everything. The rest is up to her body, her brain, her will to survive. You being here exhausted and barely functional doesn't help her. And it's destroying you. Marcus wanted to argue, but he was too tired. Chen was right. He could barely stand, could barely think straight. His hands shook when he wasn't actively using them. His vision blurred periodically. He was becoming a liability rather than an asset. 2 hours, he conceded. I'll go home for 2 hours, then come back. 4 hours, Chen negotiated. And actually sleep, not just shower and pace your apartment. Marcus left the hospital for the first time in a week. The outside world felt strange, too bright, too loud, too normal. People walked dogs and bought coffee and laughed at jokes, oblivious to the life and death struggles happening behind hospital walls. Marcus had always existed in both worlds, the normal world and the medical world. But lately, the normal world felt more foreign to him than ever. He drove to his apartment, a sparse one-bedroom that barely qualified as lived in. Unpacked boxes still lined the walls from his move after the divorce 2 years ago. The refrigerator contained expired milk and takeout containers. The only personal touch was a photo of Sarah on the nightstand. Last year's school picture, already out of date. Marcus showered, the hot water sluicing away 7 days of hospital grime. He set his alarm for 4 hours and collapsed onto his bed, fully expecting his mind to race with worry about Isabella. Instead, he fell into sleep like falling off a cliff, his exhausted body simply shutting down. He dreamed of surgery, endless surgery, opening skull after skull, finding nothing but darkness inside. He dreamed of his daughter calling for him, her voice getting fainter and fainter until he couldn't hear her at all. He dreamed of Isabella, her eyes opening, her lips forming words he couldn't understand. The phone woke him. Marcus grabbed it, disoriented, his heart pounding. Reid. Marcus, it's Chen. You need to come back. Now. His blood turned to ice. What happened? Is she... She's awake, Chen said, and Marcus could hear the smile in her voice. Marcus, Isabella's awake. She's breathing on her own. She's following commands. You need to see this. Marcus was in his car before Chen finished speaking, driving too fast through Boston traffic, his mind unable to process what he'd just heard. Awake. After everything, the crash, the surgery, the seizures, the experimental treatment, the coma. Isabella Navarro was awake. He ran into the ICU, ignoring the startled looks from staff who'd never seen Dr. Reid run anywhere. Isabella's room was crowded, nurses, doctors, Carmen crying happy tears, James laughing and crying simultaneously. And in the bed, propped up slightly, breathing tube removed, was Isabella. Her eyes were open. Hazel eyes, alert and focused, tracking movement in the room. As Marcus entered, those eyes found him, and she smiled. A small, weak smile, but unmistakably intentional. "Isabella," Marcus said, moving to her bedside. "Can you hear me?" She nodded, the movement tiny but clear. "Do you know where you are?" Another nod. "Can you squeeze my hand?" He placed his hand in hers and felt her fingers close around it. Weak, but there. She was there. "Do you know who this is?" Marcus gestured to Carmen. Isabella's eyes moved to her mother, and tears began to roll down her cheeks. Her lips moved, forming a word that came out as barely a whisper. "Mama." Carmen sobbed, leaning down to kiss her daughter's forehead, speaking rapid Spanish through her tears. James was at Isabella's other side, his hand on her shoulder, his face a mixture of joy and disbelief. Marcus stepped back, letting the family have their moment. Dr. Chen appeared beside him, her own eyes suspiciously bright. "You did it, Marcus. You actually did it." "We did it," Marcus corrected. "The whole team, and Isabella, she did most of it herself. She fought harder than any patient I've ever seen. Over the next hour, they continued testing Isabella's responses. She could move all 4 limbs, though the left side was weaker than the right. Likely temporary weakness from the brain injury. She could understand questions and respond appropriately, either with nods or by squeezing hands. Her speech was impaired. The words came slowly, slurred, effortful, but it was there. She was there. Dr. Foster performed a comprehensive neurological exam. "Remarkable," she kept saying. "Given the severity of her injuries, this is remarkable. She's going to need extensive rehab, physical therapy, speech therapy, occupational therapy. But Marcus, I think she's going to recover. Maybe not 100%, but close. Close enough to have her life back." As evening approached, Marcus finally allowed himself to believe it. Isabella Navarro, who should have died on that rain-soaked road, who should have died on the operating table, who should have died from the seizures or the treatment or any of the 100 complications that could have killed her. Isabella Navarro was going to live. She was going to recover. She was going to get her second chance. Carmen found Marcus in the hallway as he was preparing to leave. "Dr. Reid," she said, taking both his hands in hers, "you give me back my daughter. I have no words for this. Thank you is not enough." "You don't need to thank me," Marcus said. "Just help her with the rehab. It's going to be hard, frustrating. She'll want to give up sometimes. Don't let her." "She is fighter," Carmen said, smiling through fresh tears. "Like you tell me. And you are fighter too. You save her when no one else could. You are a miracle worker." Marcus shook his head. "No, I'm just a doctor who got lucky, who had a good team, who—" He stopped, unsure how to explain. "I'm just glad she's okay." He left the hospital as true night fell, driving home under a clear sky. For the first time in weeks, the weight on his shoulders felt lighter. He'd saved Isabella Navarro. Against all odds, against every statistical probability, he'd brought her back from the edge of death. But as he pulled into his apartment complex, his phone buzzed. A text from his ex-wife. "Sarah had her dance recital tonight. She looked for you in the audience. Again, you weren't there. When will you stop disappointing her? The message hit him like a physical blow. In his focus on Isabella, he'd completely forgotten about Sarah's recital. He'd promised to be there, had marked it in his calendar, and had let it slip away in the chaos of the past week, the way he let everything slip away that wasn't medical. Marcus sat in his car, staring at his phone, feeling the victory of saving Isabella's life crumble into the defeat of failing his daughter. Again. Always again. How many recitals, birthday parties, parent-teacher conferences, bedtime stories? How many moments had he missed? How many times had Sarah looked for him and found only his absence? He'd saved Isabella Navarro's life, but he was losing his daughter, one missed moment at a time. Marcus pulled up his daughter's number and called. It went to voicemail. "Hey, sweetheart, it's Daddy. I'm so sorry I missed your recital. He paused. The truth was too complicated. "I had an emergency at the hospital. But I want to hear all about it. Every detail. Call me back, okay? I love you so much." He hung up, knowing she probably wouldn't call back. Knowing that his excuses, however valid, were wearing thin. Knowing that someday soon, Sarah would stop looking for him in audiences, stop expecting him to show up, stop caring whether he was there or not. And that would hurt worse than anything else. 3 months later, Marcus stood in the hospital lobby, barely recognizing the woman walking toward him. Isabella Navarro looked nothing like the broken patient who'd occupied his thoughts for those intense 7 days. She moved with a slight limp, residual weakness on her left side. But she moved under her own power, confidently, purposefully. Her dark hair had grown back, covering the surgical scars. Her hazel eyes were bright, alert, full of life. "Dr. Reid," she said, her speech still slightly slow but clear and understandable. She'd worked hard in speech therapy, relearning how to form words, how to express the thoughts that her brain could formulate, but her mouth struggled to convey. "Ms. Navarro, you look—" Marcus smiled, like someone who didn't almost die 3 months ago. "I feel like someone who got very lucky," Isabella said. She gestured to James, who stood beside her, and to Carmen, who beamed with pride. "My family wanted to be here for this." "For what?" Marcus asked, confused. Isabella reached into her bag and pulled out a folder. "I'm back at work. Part-time for now, but back. The company held my position, held that deal I was supposed to close the morning after." She paused, the memory still difficult. "The morning after the accident. I closed it last week. 2 months late. But I closed it." "That's wonderful," Marcus said sincerely. "I'm happy for you. But that's not why I'm here." Isabella opened the folder. "I'm starting a foundation, the Navarro Medical Innovation Fund. We're going to provide grants to doctors who want to try experimental treatments for patients with no other options. Doctors who are willing to take risks, to push boundaries, to fight for patients that conventional medicine has given up on." She handed him a document. "You're our first grant recipient, Dr. Reid. $1 million to support your research and treatment protocols for traumatic brain injury. Because what you did for me, that needs to be available to other patients. Other families who are facing impossible odds." Marcus stared at the document, unable to speak. $1 million. Enough to fund clinical trials, to develop proper protocols, to turn his desperate last-ditch effort into a legitimate treatment option. "I don't know what to say," he finally managed. "Say you'll use it," Isabella said. "Say you'll help other people the way you helped me. Say you'll keep fighting impossible battles, because sometimes, impossibly, you win." Marcus looked at her, at this vibrant, living, breathing proof that medicine could work miracles when combined with stubbornness and skill and a refusal to accept defeat. He thought about all the other Isabellas out there, the patients who would face similar crises, who would need someone to fight for them the way he'd fought for her. And he thought about Sarah, about the price his daughter had paid for his dedication, about whether he could find a way to be both the doctor who saved lives and the father who showed up for dance recitals. "I'll use it," he said, "and I'll make it count. I promise you that." Isabella smiled, then did something unexpected. She hugged him. Marcus stood stiffly for a moment, unused to physical affection from patients, then relaxed and returned the embrace. When she pulled back, there were tears in her eyes. "Thank you for my life," she whispered. "Thank you for not giving up." "Thank you for fighting," Marcus replied. "You did the hard part. I just gave you the chance." As Isabella and her family left, Marcus stood in the lobby, holding the folder, feeling the weight of new responsibility and new possibility. His phone buzzed, a text from his daughter. "Daddy, can you come to my soccer game Saturday? Please, I really want you to be there." Marcus looked at the message for a long moment. Then he typed, "I'll be there, sweetheart. Front row. I promise." This time, he meant it. This time, he would keep the promise. Because saving Isabella Navarro had taught him something important. That fighting for life meant fighting for all of it. Not just the parts that happened in operating rooms. It meant showing up for the people who loved you, not just the strangers who needed you. It meant being a healer in every aspect of his life, not just the professional one. Marcus Reid walked out of the hospital into the Boston sunshine, carrying $1 million grant and a renewed commitment to being present, to being better, to finding balance between the doctor and the father, the healer and the human. Behind him, in the ICU where Isabella had fought for her life, new patients were arriving, new crises were unfolding, new battles were beginning. And Marcus would fight them all, just as he always had. But on Saturday, he would be at a soccer game, cheering for his daughter. And that, he realized, was its own kind of miracle. The rain had stopped weeks ago. The storm had passed. And in its wake, everyone, Isabella, Marcus, even little Sarah, had a chance to start again. To build something better. To live fully in the second chances they'd been given. In medicine, Marcus had learned, you couldn't save everyone. But the ones you did save made all the sleepless nights, all the impossible choices, all the personal costs worthwhile. They reminded you why you became a doctor in the first place. Not for glory or recognition, but for moments like these. Moments when death lost and life won. Moments when the impossible became possible. Moments when miracles happened. And as Marcus drove toward his apartment, toward a phone call with his daughter, toward a future that held both medicine and family, he allowed himself something he rarely did. A moment of peace, of satisfaction, of hope that tomorrow might be better than today. That was enough. For now, that was more than enough.